How many, Jen? Ada 9. Okay, dah. Okay, right. So we wait for a few minutes. Let more people to join us.
Yeah, exactly.
Okay, I think we start 10:05. Wait for other people to join us.
For the starting session, are we going to mute all the participants?
Yes. First, I'll talk. Then, when you talk, we will mute other people. And when Mr. Zabidi talk, we will mute. So let him talk.
Okay. Then we just open during the Q&A session, lah.
Right.
Okay, right. Thank you. Thank you.
Ada angkat tangan. Awal sangat angkat tangan tu.
Oh, now on YouTube. Live.
On YouTube.
Okay, a very good morning, ladies and gentlemen. Okay,
Yes.
we will start our session today. Welcome to all the participants for our first series on PWS webinar. Today title what we call it Paving a Pathway Towards Sustainable Workforce System. We are talking about how the company can implement performance-based or PWS system to enhance their productivity and performance. Today we have two distinguished guests. One is our moderator, Mr. Vincent, and our second distinguished guest will be our speaker, Mr. Zabidi Haji Abdul Razak, CEO of KPJ Penang Specialty Hospital. So let me briefly introduce our moderator today, Mr. Vincent. Mr. Vincent is a local technopreneur with MBA and currently the director of GSH Precision Technologies in Jemberhat. He has been in the manufacturing sector since 1990 and widely exposed in the precision tooling, automation, equipment assembly, and robotics. He has mentored many SMEs in this related sector and continue to support every SME towards Industry 4.0. He also sits on various trade industries and education bodies at state and federal level. That's a very brief introduction. Of course, you have more things to talk about him, but briefly, I just give you some brief introduction of him. Also, we have another distinguished, the Zabidi Haji Razak, one well-known KPJ Penang Specialty Hospital. And for your information, KPJ Penang Special Hospital is an award winner on what you call production link waste system, okay, organized by MOCHAR and also NPC. Without further ado, Mr. Vincent, I hand over to you this session. Hand over to you, Mr. Vincent.
Thank you, Mr. Sugu, for a wonderful presentation. Good morning to all of you, as well as the participants who have just registered with us today. We have to thank our host, MPC, for hosting this productivity link wage system webinar series of one, which it is today. And our key topic today would be on paving a pathway towards a sustainable workforce system, which will be presented by our very distinguished speaker and experienced man, Encik Zabidi Haji Abdul Razak, who is the Chief Executive Officer of KPJ Penang Specialist Hospital. Well, the objective of this session today would be basically to share the best practice of productivity linked wage system, or in other words, PLWS, in our organization. And also he will be sharing the benefits and challenges that he has encountered while implementing and adopting this whole system. Now, further on this topic, we would like to give a brief CV of our speaker, distinguished speaker, that is Encik Zabidi, who hails from Kedah and married with 3 boys, wonderful boys. And his contribution to the nation that we have encountered was developing and implementing the Malaysian Healthcare Accreditation Program, which is a very key program that which was really focused on the healthcare activities. And he has represented in a lot of activities in Penang, especially Association of the Private Hospitals in Malaysia, where he was associated with the National Key Economic Areas, that's the NKEA. for the health sector of the Economic Inclusion Program, which is under the Prime Minister's Department. That was from July to December of 2010. During his working experience, he has acquired a lot of knowledge and exposure, where he was from the business development executive, right up to the chief executive or officer from Kedah Medical Center, KPJ Johor Specialist Hospital, and to where he is today is KPJ Penang Specialist Hospital, which is the chief executive officer. And he holds a diploma in management as well as a bachelor in economics from International Islamic University. And he was even awarded the popularity champion by the NPC in year 2019 to 2021. And he is also the Malaysian Society of the Quality Health platform, and also corporate planning executive and for the Kumpulan Perubatan Johor, which is an established public listed company in our Bursa Saham Malaysia. And he will be assisted with our distinguished associate, that is Puan Mira, who is together with Zabidi today. And both of them will be presenting their papers shortly. So without much ado, I leave to Encik Zabidi to do his presentation. Encik Zabidi.
Yeah. Thank you very much, Mr. Suguma and Vincent, for a very good introduction. Assalamualaikum warahmatullahi wabarakatuh, and very good morning to all participants.
Good morning.
We have 15 attendees so far, including 5 panelists. Okay, allow me to share. First of all, thank you very much also to Dr. Sureti and the team from NPC for allowing me to share my knowledge and experience in the hospital management, in particular, in this topic today, towards paving a pathway towards a sustainable workforce. So I introduce, I give introduction about the hospital, who we are, and then we will zoom into the PWS later.
Okay.
Okay, these are my team members. They are all my heads of services. I'm fortunate to have them here in this hospital because they are hardworking and very dedicated team of head of services in KPG Penang. Who we are? We are the 19th of 28th KPG Hospital. We opened to public on 1st August 2009. We have just celebrated our 10th anniversary this year. Last year. And we are accredited by Malaysia Society for Quality in Health, MSQH, and we are also internationally accredited by Joint Commission International. I'm proud to say that we are the only private hospital in the northern state of Malaysia. And we are also certified in KMS, Environmental, Occupational Safety and Health by ITUB. And we are certified friendly by Ministry of Health Malaysia. We are also 5S certified by NPC. And our kitchen is certified halal by JAKIM. And we have been awarded by KPJ and as the best managed hospital for 5 years. Yeah. And we also awarded by KPJ in terms of clinical practice, the best clinical practice hospital for 3 years. KPJ Penang at a glance. Now we have about 39 consultants. 33 of them are resident. This is as at 31st December 2019. This year we have increased one more consultant. And we are, as mentioned before, we are accredited, fully accredited hospital. We have 193 licensed beds. And we are awarded, in fact, a total of 23 national and international awards we have received. 23 national and international awards. And in terms of productivity and innovation, we managed to get 16 awards. And we have done 141 Kaizen and a total of 271 initiatives so far. And national and international accreditation certification, we managed to get 10. And I myself received a leadership award from NPC, as mentioned by Vincent just now. And we have registered a total of 20,375 inpatient and 123,417 outpatient as at last year. And the services that we are outsourcing actually 5, yeah. Lab, we outsource to KPJ's Lab Link. Inpatient services, we outsource to Besta. Housekeeping, we have an outsourced company, Akiran, doing the housekeeping. And security, we have 21 personnel, and linen 6. Yeah. And as at this year, we have a total of 619 actually as at today. Yeah. Comprising mostly more than 50% are nurses, followed by allied health professional and also support services. Our mission is to deliver quality healthcare services, and our vision is to be the preferred healthcare provider in the country. So this is our ultimate aim. Eh? And our core values, which is part and parcel of us, part and parcel of our services, we always emphasize on safety. Safety is our utmost priority. In KPJ hospital, safety is not compromised at all. Nothing can be swept on the carpets. And in terms of courtesy, we focus on services. In fact, we train our staff, our personnel, a specific program. And integrity is also not compromised in KPJ. So we hope our staff able to provide services with high integrity, professionalism, and of course, in terms of continuous improvement, we have to continue it because yesterday's quality is different than today, and tomorrow will be another. I mean, is also different. So these are the core values which important for us in KPJ. This is just to share our hospital organization chart. So we have clear roles. We have clinical and also non-clinical, which focus on overall hospital operation and administration as well. We are deeply, of course, affected by the global economic situation currently, especially in facing COVID, and also Malaysian economy. We are a part of, in fact, we are complementing the Malaysian healthcare sector, complementing the government in providing the service to the government, to the people. And of course, you know, the regulatory environment in Malaysia is also affecting our service. And we are getting more and more competitive nowadays. In fact, in Penang itself, at least one more private hospital is coming up soon in Penang. And technology and medical innovation, you know, technology change very fast, especially in the medical world. In doing this business, I mean, in healthcare itself, you know, we have to understand the reason of our existence. In fact, in any business. So where does our business exist? Yeah, it is an important question before we proceed with the business. Of course, this is according to Peter Drucker and the famous strategy group. Business exists because of its customer, yeah? And hospital also, we exist because of our patient. So we have to understand that, you know, KPJ as a whole and KPJ Penang, we are part of a society, especially for KPJ Penang, we are part of society in Seberang Perai, Penang, and also northern area. So there are two sides of the equation: is supply and demand. You know, the demand for healthcare, and we have to do the best to deliver the service to our customers in the surrounding area. And of course, customers are looking for value. So in exchange of what they pay. And these are the most important thing that I keep on emphasizing to the staff. Yeah. The first thing that I ask when I meet, the new staff during the orientation program with them, yeah? What is the reason, the main reason of their existence in the hospital? And I keep on emphasizing, the main reason is to serve. Again and again in almost every session that we have with the staff, because we used to have monthly gathering before COVID. Yeah? So this is very important. One of the positive value that we have to inculcate among our team members or our family members. Yeah? They have to really understand why they are here, where they are chosen to be here. And these are our stakeholders. Of course, the significant one that we are going to discuss today is our employees, our local communities that we're serving now. And of course, our investor and shareholder, especially KPJ as a public listed company, and our SKPJ Penang. And the shareholder is KPJ, the majority shareholder, 100% owned by KPJ. And of course, the patient, and most of our patient, I think KPJ Penang now is more than, majority of them, more than 85%, they're using insurance or third party MCO. And government regulation is also important, because healthcare, private healthcare, especially in Malaysia, is heavily or highly regulated. So we have to comply with all the rules and regulation. And of course, the supplier, they are our partners. And in terms of managing quality and safety, we have to have certification from the external bodies to ensure that we maintain or keep up with the latest safety and quality requirements. So this is, we're going back to the main topic, and what is the workforce sustainability. You need not read all of this. Just try to understand the keywords. Try to connect the keywords. Sustainable workforce. It's related to the work environment and of course the employee well-being. Yeah? This is how to promote or to enhance their skill, the talent, and to use their energies well within the organization. Yeah? The first thing that I did when I came here in Penang is to ensure that there is no staff burnout, especially the nursing division. Yeah? Of course, we have many committed staff who are willing to assist their colleagues, for example, who cannot do extra time, for example, or they have to fulfill other commitments. So there are employees who are willing to cover for them, for example. So we are now ensuring that this thing is not happening in order to reduce staff burnout. Yeah? So we are increasing our number of nurses to ensure that they have balanced time at the hospital and also at home. So in KPJ Penang, of course, we have to ensure that human resources are managed in a sustainable way so that they flourish. And then we continue to promote creativity and innovation in this organization, and to enhance in terms of engagement, improve their relationship within among the colleagues in the hospital as well, and hopefully it enhances our business performance. And this is one of the best definition that I came across in the book by the guys that I put below in the reference, Work and Well-Being by Alan Koshek, Monique Walcott, and also Pamela. I've read this book sometime by this book entitled The Service Profit Change by J. Heskett, Cesar, and also, I hope I pronounce right, Slizinger. sometime in in early 1990s. Yeah? So I believe in this, yeah, the service profit chain theory. Yeah? And I began implementing it when I was in the first hospital actually in Johor. And then when I moved to Kedah, because there is a very strong relationship, between employee satisfaction, customer satisfaction, customer loyalty, and ultimately, the figures will follow. Yeah, it is evident, yeah, based on my previous track record in Johor and also in Kedah, followed by Penang. Yeah. So in KPG Penang, more than 90%, I would say about 95% of our customers are loyal customers, repeat customers. And based on the feedback that I got from them directly, and also some corporate figures, they are very happy with what we are providing now, the service, the value that we are giving to them. And of course, Pareto rules they apply in any organization, and there are still unhappy staff, unhappy guests, yeah, that we have to really take care. But we are trying our best to improve both the staff satisfaction and also customer satisfaction. And I'm sharing about this in the next slides, few slides. And internally, KPJ as a whole, we have a very good KPJ culture. And we have best practices at almost every hospital in the group. Yeah, we have policies and procedures developed by the KPJ and also hospital, and we have processes to ensure that whatever we have complied with by the staff. And KPJ Penang as a whole, or KPJ even, we encourage learning, continuous learning and development, and we promote staff to learn more, formal and informal. In fact, KPJ is encouraging staff to go for not just MBA, but also to pursue PhD as well. Yeah? And there are also continuous engagement between us, which I will share in the next slide. And of course, we monitor. We have a proper monitoring system in place to review our performance, our staff performance, with customer feedback, external and internal, are taken into consideration, and also a formal staff performance appraisal system in place. We appraise twice a year in our hospital. And of course, we continue to recruit talent, which is not easy nowadays to get the right person for the right job. Job fitting is not easy nowadays, due to some factors. Healthcare or hospital in particular, we have to juggle because we are, I think, only few business among the few industry in the world which are both capital and labor intensive. So our equipment are expensive, the manpower is also expensive. So we have to have balance, between the resources, among the resources that we have, the financial, equipment, manpower, and also the material, or the for example, the cost of drug and also equipment and also disposable are expensive nowadays. So it is a very complex business, I would say. Managing hospital is not easy. A different department, they have their own decision-making process. So we have to balance among them all. Yeah? So according to the World Economic Forum, these are the 4 things that business leaders must do to build a sustainable workforce. One is invest in education. I think we are doing it a lot. Since the last 30 years, I would say KPJ has invested a lot especially even we sponsored MBA program, for example. We sponsored specific program to nurture our nurses, to enhance and develop our nurses, to do post-basic or specialized program. So we are providing learning opportunities for our staff. Yeah? So this is part of, it is top-down approach, yeah? From the leadership at group and also hospital level. And we are now also taking advantage of the latest technology available to optimize our reskilling, yeah? in order to enhance our staff development. Yeah? So we are in line, in fact. Yeah? So this is according to the Future of Job Report, World Economic Forum. By 2022, we have to spend about 1/3 of our time learning, of course, as an adult also we have to continue learning. Because why? Basically, the manual dexterity now has been declining. In fact, I myself, my writing skill has declined. Yeah? I used to write a lot, but now, I cannot write because I use computers more. And then the creativity, in using technology now, it is increasing. Yeah? And people are using the technology to influence the society. Yeah? In fact, now, social influencer is another profession, yeah? as I think we are aware. And so, and digital nomad now is another career that is happening worldwide. Yeah? So we have to do more, to invest more, educate more in order to achieve a sustainable workforce. Yeah? And now let us focus on the PLWS model that KPJ Penang is practicing now. There are 3 models, yeah, basically. Yeah? Productivity, employee performance model, and combined model. And KPJ now is using combined. KPJ Penang is using combined model because we combine the performance of individual, departmental, and also hospital, and also KPJ group into our performance link incentive system. In fact, KPJ is giving also extra incentive for example, for best managed hospital, we got it 5 times extra bonus, sort of. And also, if we manage to achieve the reward from outside, we will be given also extra reward by KPJ as well. I go to detail, but I cannot put figures here, but I'm proud right now. I think most of the staff are proud to be part of KPJ. Even during this difficult time, we managed to get up to 3 months of bonus this year. Yeah? So the quantum of bonus is based on overall hospital and group performance. And also we got salary increment up to 10% and adjustment, salary increment and adjustment given the difficult period this year, of about 10%. And of course, okay, before that, I wish to highlight the numbers in yellow are given by KPJ, is group, but the numbers in blue are exclusive to KPJ Penang only. KPJ Penang is also giving reward to individual and group achievement. For example, if our staff managed to complete master program, and if a certain group, based on the best practices, we give them rewards and hampers, for example, and winners of ICC also will get rewards. For example, this year I treated them with dinner and best Kaizen, of course, and winner of weight loss program. We also do weight loss program and we send them to overseas. The winners we send to Phuket and also China, this year. And staff, this is immediate, instant reward. Who receive compliment, normally compliment in Facebook or written compliment or informs, immediately I give them vouchers, so that they can spend in our cafes or restaurants outside nearby. And we are also giving them rewards whenever we achieve our target. For example, our monthly target. So in KPG Penang, we treat every members, even though outsourced company staff, we treat them as our family. So we give everybody. For example, if we achieve target, I bought them a packet of Bliss yogurt or ice cream, or I give them food vouchers immediately, so they know if they get it, that means they have achieved the monthly target. Everybody, including housekeeping staff and also security. For nursing, if let's say we achieve certain numbers of occupancy rate, for example, achieve certain target, they get free breakfast. The next day, they get free breakfast. So they know if they get nice nasi lemak, that means they have achieved the target. And if a certain department or certain group, if they manage to do some cost or time saving, we give them dinner or trip. Not overseas, it's domestic trip to that unit or department. And I treated them with luncheon as well. And if they have come up with new ideas that can be implemented in the hospital, they also get gift from us. And we are giving also special allowances on multitasking. So for the staff, for example, professionists, become business officer, pharmacy assistant, who become a safety officer, and our hospital engineer, who become authorized personnel, for example, for medical guest, medical officer with POSH certification, service quality management officer, who become a trainer or coach, and also outsourced executive who become competent person for waste management, they get allowance for multitasking. And for the staff who have extra skill, for example, pharmacists, medical officer, they get skill allowance as well. And we are giving our teaching allowance to our nurse instructor. We also have a language teacher among our staff who teach, for example, Mandarin. They are also getting teaching allowance from us. And of course, on-call allowances to the relevant services. We are giving a special allowance to our hospital drivers, and also a special incentive for our marketing personnel. For your information, we treat our drivers as our ambassador as well in this hospital. And they are among the first contact with patients, especially patients coming from overseas. That's why our drivers are very important in this hospital. And we're giving incentive for them as well, for official trip, more than 300 kilometers, and medical officer will get this extra incentive. For every patient, they get certain amount of ringgit. For every procedure done, they get extra, and also for every medical report done, they get extra. This is more than their salary actually. And they are getting, some of them getting double, I think, in fact, every month from these allowances. And dispatch allowance to our staff, language allowance, as I mentioned before, but this this language allowance is given to the staff who can speak other language than mother tongues. For example, we have staff who can speak Thai language. There are Chinese staff who can speak Tamil, and there are staff who can speak Arabic as well. So we are giving them extra language allowance. And incentive for specialist nurses. These are nurses who have undergone post-basic training. And during COVID period, we are giving allowances to all the frontliners who are doing COVID tests and screening. So it is a very stressful area, especially during the first few months of COVID. Stressful, and they have to wear full PPE, very hot, humid condition. So we have to give them extra during this period. Yeah? And in terms of when we implement the PWS in this hospital, in terms of benefit to employees as a whole, we could notice the increase of benefit to the employees in 2017, 13%, 2018, 11%, and 2019, 18%. So if you look at the figures, increased number of staff is only 2%, but the net income of this overall staff is 13% in 2017. So the benefit to employer, our profit, the blue line, increased 14% in 2019 compared to the same period in 2018. And cost saving, we managed to reduce about 5%. There are various efforts done by various departments. And in terms of labor productivity, we managed to increase 9% in 2019. This is a tool that we are using to measure the performance of our staff. Overall, the performance is increasing. The number of competent staff has also increased over the years. In fact, last year, we registered 316 competent staff, and with more and more staff under Superior 1 and Superior 2 group as well. And we have quite a number of staff who registered, who managed to get excellent rating in our performance appraisal. And in terms of feedback from patient, we do diligent survey, diligent customer survey done by our service quality management team. And I'm proud to share that we are among the highest in KPJ group in terms of customer satisfaction feedback since the last 3 years. Our patient survey has also indicated very positive feedback from our customers. So it's not easy actually to even achieve 80% because the KPI given by KPJ group is 80%. So we have a dedicated team to look into this. And in terms of leadership, I'm not talking about myself alone, is leadership at all levels, from group level at HQ, from our board member, from the board, from the hospital, myself, and also all head of services in KPJ, Penang, and or KPJ as a whole. We have 360-degree peer review process, and I myself are being assessed by the board member and also head of services, and it will be part of our KPI, key performance indicators, and it is evidence. I myself, on behalf of the hospital, has received award from the state, also award from the NPC last year in the recognition of our leadership in this hospital. And this hospital, or KPJ as a whole, we have clear source of information. We have ample data in order to provide a proper strategic plan. We have group KPI, hospital KPI that we have to follow, and market analysis that we have to do. And of course, customer feedback now is getting more and more important. We do regular surveys done by our service quality management team and our clinical based risk management system. We have what we call QRADA, online reporting system. So nothing is nothing can be swept on the carpet in the system, because our system is to look into the system first before we look into individual in this hospital. And of course, we have enterprise-wide risk management system. And in terms of operation, every department will have quality objective, performance indicators, and individual activities, and also supplier evaluation performance system. And overall, we have hospital information system. And in terms of knowledge management, we make sure whatever information receive our staff fast in this hospital. Immediate information that require immediate attention, we will disseminate it through our SMS system. We also use WhatsApp system, and also we have our online intranet, system that we can share immediately among our staff and also head of services. We have user metric system in our internet system, so that only certain individual can access certain information. For example, if you want to have a memo to our consultant, we don't do hard copy anymore. We text to them that for them to refer our memos in the internet. And now, in view of the current situation, we are going very aggressive in online training, and also we conduct seminars or education to our customers using online system. And this is part and parcel of our activities. For example, we have what we call pedoman, where our president or managing directors will share with us, and he'll go to almost every hospital in the group, and he will share the objective, what we ought to do, and the achievement that we have achieved in the last year, for example. And it's also a session to motivate the staff to do better every year. And at KPJ Penang level, we conduct monthly meeting with all the staff, monthly gathering, and also, of course, a regular meeting. And we establish our policies, procedure, proper system. We establish our own KPJ Penang portal with all information in place over there, accessible to everybody. And we conduct a regular orientation program to the staff and doctors. And we continue to have this staff engagement program. In fact, it's regular activities among the staff before COVID. So these are the regular things that we have: monthly meeting, quarterly meeting, ad hoc meeting, and memo online, hospital intranet, and also regular infoblast. In KPJ Penang, we have a clear succession planning. We know which candidate who are potential for us to grow further based on the performance, and based on their participation, based on their activities in the hospital, based on recommendation by the head of services, and they are assessed objectively. So we have a clear selection criteria to assess our staff. And of course, we develop proper training program for them. And we monitor their performance regularly. So in fact, we have a clear career path for every staff in this hospital. This hospital, I'm proud to say that we are very innovative. We have done a lot of things, and the staff has contributed a lot of ideas, and we continue to innovate. The left hand, if you can see from the slide, the left-hand side is developed by KPJ. We have hospital information system, clinical information system, bed management system, picture archiving communication system, and also lab information system. These are all systems given by KPJ. But based on the requirement of the services, the need to improve our processes, our communication and improve our system, communication among the staff and also patient. We develop ourselves this system. For example, OT system. We have a system where even the person accompanying a patient will know what happened to the patient in the OT. For example, is she or he in the recovery area, or has the operation been completed or not? So they can see from the screen provided at the waiting area. Yeah? And we understood because there were a lot of complaints about the system in our dialysis, because there were patients waiting for hours to wait for their turn in dialysis. Now, the patient can monitor from their home when is their time, right? They're supposed to come at what time at the hospital. So they know by using their handphone through the application, the appointment time. And medical report, this is another problem that we were facing before. Monitoring the medical report by consultant, because there are a lot of requests by the lawyers, by the insurance companies. So right now, the consultant know how many reports they have to do, how many reports that already overdue. We have a system to alert and support our consultant. And business office as well. This helped them a lot, you know. The IT department has developed a system. They know the progress of payment of every individual patient, the progress of feedback from insurance companies real time. Yeah? So we can monitor the progress real time. Stationery, in fact, now the staff, before they order, if they know the price of a pen, the price of an eraser or marker. So when we develop this system, we noticed there is a downward in terms of the number of orders decreasing, and we are controlling our inventory of stationery as well now. So these are among few examples that that I can share with you. In fact, these are developed together with the staff, with the input from the respective department, the consultant, and also the expertise from our IT department, our programmer. Yeah? And this is among the latest innovation that I would like to share with our guests today, listener today. We have developed you know, this is because COVID. For example, the sanitizer system. It is a very stressful, I must confess, in our hospital environment during this COVID period. We have to ensure that all our staff, all our doctors comply, and because we are KPJ Penang, we are subscribing to the WHO patient safety goals. So we have to make sure that our hand hygiene is complied 100% by our personnel. So we invent a system that can monitor each individual staff using face recognition system linked to the computer. We know who follow the 5 moments, what we call it 5 moments in ensuring the hand hygiene. We know which staff yang tak comply, for example, and we know whoever yang comply. So, and then we try to enhance, we collaborate with UNIMAC and the engineering department UNIMAC to enhance the system. Yeah? And we got gold award from the MPC. Yeah? So we hope to patent this thing and also implement or commercialize this thing and also implement in hospital, KPJ hospital nationwide. And another thing that we invent immediately is mobile disinfection chamber. This is in view of the safety of our staff during the first 3 weeks of COVID. Yeah? We are using hypochlorous. The chamber is being used until today. Hypochlorous, which is safe. It's not alcohol. which is safe for human. And another thing that I would like to share is the flexi support on the top corner there, top right corner. We are now in the process of patenting this thing. This is the only one of its kind in the world, which assists the X-ray department in doing X-ray for the motor vehicle accident or injured patient. This will help them in doing the X-ray, position the limb properly, and also reduce the pain. We have received the award last year from Hospital Management Asia for this invention. And now we are working with UNIMED as well on augmented reality. This is an education tool to help patients understanding the heart diseases, what happened to their heart. And for example, so when we show this to the patient, it's easier for them to understand, and also it's easier for our consultant to explain to them. And another project they were working now is on using RFID for our staff attendant, our baby identification safety type, and also our asset management. So it's ongoing progress right now. And this is another interesting initiative that we are doing, that we have done. In fact, we have used our last batch of plastic bottle to cool our surau, our prayer room. In fact, we managed to reduce the temperature up to 5 degrees during hot day. Because KPJ Penang now is moving towards zero plastic. This is the LIM project. I tried to go faster. LIM project that we've done, we managed to save about 2.8 million last year. And again, as I mentioned before, we are using a lot of telemarketing, telemedicine, digital marketing. We have done a lot of innovation. In fact, during COVID, we have done pharmacy home delivery service. And we acted fast during MCO. It was very hard to our staff as well. So we give them a bag of rice, and we arrange with Pharma to supply fresh vegetable daily to our staff. And we work with LKIM as well to deliver fresh seafood to the staff, so that this is to ensure their safety. They may not go to the shop to buy fish during this difficult period. And another one, during this COVID, we were facing shortage of PPE. We made ourselves. We have a lot of many tailors in this hospital. I say we made our own PPE from head to toe during the difficult period, and we have done a lot of things during MCO. We supported the orang asli families as well. And as I mentioned before, we have a dedicated team to look into the services. We have specific tool to measure our performance. We have our patient ambassadors to take care of our patient. We have specific training for frontliners. And we recognize our drivers as our main players as well. And these are the figures. In terms of diversity of the workforce, we are quite diversified. In fact, our ratios is more than the actual population ratio in Penang. So there are more non-Bumiputera in this hospital compared to the population ratio in Penang. As mentioned before, we employ disabled staff as well. And we have clear progression plan. A nurse can be CEO in this hospital. A normal officer can be a CEO as well, regardless of their service or background. And these are the evidence that we did. We have done the staff survey, and that's why KPJ has improved, has revised, because the main concern was salary. A lot of best practices have been practiced at this hospital, a lot of staff engagement. we have our vegetable garden, and the veggies are given to every staff, and every department is given the opportunity to take care of the garden every month. Again, many activities in this hospital, yeah. And we share the knowledge with other organizations. And as mentioned before, we receive recognition from the state and also from NPC. And evidence, we achieved our KPI 2019. It's not easy, the KPI is a bit tough, given by KPJ. It's not easy to achieve. Both clinical and non-clinical. And this is evident. In fact, this is actual graph. I removed the figures. This is the revenue that, it shows the continuous growth of this hospital. The profit is continue to grow. And our Waka clinic also is progressing very well. This is our contribution to give back part of our profit to society. And this is the value that we created in 2019. Proven track record. Back to my earlier slide. Whatever that we are doing now is because we are fortunate, we have the right people to do the right things right. We have the right place, safe environment, and so far we managed to achieve good outcome. I mentioned before, last year we managed to get the LWS award from the minister. And we are proud to say that we are world-class hospital in Penang with all this achievement. Thank you. Sorry, Vincent, that I exceeded the time given.
Okay, wonderful and excellent presentation that you have just done. And I can see there's a lot of achievement that you have accomplished for the KPJ hospital. Congratulations, Encik Zabidi, for your hard work and your innovative mind towards building up the business to the next level. So without much ado, could we have any questions from attendees for Encik Zabidi to take up your questions? Maybe I could ask for a starter, if I may.
Yeah.
Okay. It is very what do you call interesting to see that your hospital KPJ has been managed for 5 times on clinical and as well on management, which is very exciting. It will be very interesting if you can share how do you keep up with that level of achievement for 5 times on management as well as on the clinical 3 times.
Okay, thank you. First of all, I'm proud to share we have a dedicated team members, I would say, because this hospital is still young in the group. It's just about 10 years. Yeah? And I'm fortunate we have a very good team members among our head of services and a very good team spirit among the staff. And whatever that I inspire them to do, they will try to do the best, without question us sort of, in this hospital. And one thing that I try to inculcate in this hospital since my day one in this hospital, of course, the foundation from the earlier management, since the beginning of this hospital is very strong already. I must commend our CEOs before in setting up a very good foundation in this hospital. And here in KPJ Penang, what I'm sharing is not from my view, it's the view from our customers. The moment they entered this hospital, they could feel the difference. It's warm, you know, the staff will greet them. You know, in fact, every day, my challenge every day, I'm telling you, is to greet them first. And more often than not, I will fail because my staff will greet me first. So it's the teamwork, it's the spirit of togetherness and respect. Because here we respect each other regardless of position. Even the security guard, you know, even the housekeeping, I always tell my staff, you know, we have to give them due respect, and they are the first person to see patient every day. You know, so
right.
This is the thing, you know, that we could grow together. You know, so whatever we challenge them, they will accept it, and they try their best to achieve whatever KPI given by the group.
Wow, wonderful, wonderful, Encik.
Mm.
On the other hand, you have a lot of educational programs for your staff, which is very continuously done practically every year to further enhance the talent of the current talent. That has been done at all levels of the workforce?
It's all level. In fact, we have to do 100% training every staff every year. So it's all level. In fact, we have now dedicated staff to even look at what we call service quality management, to keep on reminding and training them standard people practice, for example, you know. So staff, including our outsourced services, will know at least read, how to smile, how to show direction to our customers. And then, of course, every department will have their needs, the needs to improve their services, and we continue to train based on specific requirement of every department and also staff to be developed.
I see.
In this hospital is involved in training regularly.
I can see there's a lot of competition in the hospitals sector in Penang.
Yeah.
A lot of hospitals are up, and new one, as you just mentioned clearly, there was another one is coming up, very big one.
Yeah.
And it's a tough industry. It's not going to be easy journey for everyone, but having this PLWS would be something very useful for the industry to keep their momentum moving aggressively. How do you find that when you want to implement your PLSWS? Was there any challenges that you faced implementing?
Initially, no, we don't have really significant challenges among the staff because because our turnover is low. Turnover rate is low, and in fact below 5%. In fact, the significant figure of the turnover is mainly because of the staff transfer. They need to follow their husband. So we have only few staff who left to, for example, Middle East or to and then, in fact, I remember my previous boss messaged very well. Tan Sri Siti Sadia Shebake. She said, we did not worry, because KPJ, we train people, but we contribute to the nation, regardless where they are. We are proud of that. And KPJ Penang, I'm not worried because we inculcate positive value to our staff. In fact, for your information, Mr. Vincent, in fact, during my time here, few of them regretted leaving the hospital and they wanted to come back. They appealed to come back to this hospital. Yeah, this is evident.
That's interesting. That's interesting. Now, what are the main elements that you use on implementing or to give a kickstart on the PLWS KPJ?
Basically, try to appreciate what they have done to us, Vincent. We value them. We value them. It is to me, we value everybody in this hospital. Of course, from day one, we show them that we respect. So we ask them to respect each other. So with this, we reward them what they have done. We show that we appreciate what they have done. That's how we grow one by one,
Wonderful.
For example, during COVID, it was very difficult. It was very hard. They were afraid of the, everybody was afraid of the virus, but we support. We give them moral support and financial support as well. We give them extra allowances for whoever, doing the job.
So during COVID period, you had your PLSWS. So during the COVID period in the PWS, how would you gauge that the response from your staff during this tough time?
Basically, they're happy. In fact, now, because of the consciousness, awareness of the safety, because we give them sort of full protection. We give them PPE. We continue to remind them, educate them on the preventive measures, so they're confident now. We are doing the right things right in this hospital. So if it was a lot of morals, I think it's a lot of moral support. I go down, see them regularly, even in the tents, while doing the testing, because we have to do it outside in hot condition. We have to put air condition. This is the temperature. It's difficult situation right now. Yeah.
Wonderful, sir. Wonderful. Wonderful. Now let's get back to the attendees. Will there be any questions? If any of the questions would you like to ask the attendee side? There is one from Nagaya Ramaswamy, who has just asked a question. What is the turnover rate among the operational staff members?
It's around 10, average of 10%.
Overall, it's about 10%. Yeah? Overall, it's 10%, but majority are living to our sister hospital.
Okay.
Them transferred to our sister hospital in the group. Then 5% left us.
All right.
Left the hospital and left the group. It's about 3% only. They went to Middle East, and some of them are left to other organizations, not just hospital and other organizations, especially non-nursing.
Wonderful. There's another question from Dr. Suryati. What is the advice to any companies how to implement PWS at their workforce? I mean, the workplace.
As I put in one slide today, just now, you have to understand your reason of existence. Why you are in this business, and then, of course, you have to appreciate your staff. They are part of us. They are part of you. Without them, we don't know who we are, who we could be. So those are two things that I value the most. So it's the positive value that we have to inculcate in our organization, and we ourselves, must be humble enough to go down to the lowest level to understand their predicament, their problem, so that we can do more to help them in promoting the so-called healthy business working environment in this organization. Yeah?
As I was told by the MPC that we have some company around 89,000 companies implementing PLWS. We hope to see more companies implementing and adopting this PLWS for enhancing further their operation. We look forward, and I don't see any other questions up today.
Okay, Vincent, there's a question from Sugu here.
Yes,
Zabidi, due to the COVID-19, some companies have difficulties to maintain their business. Some go towards retrenchment, layoff of the employees. How do you think that this PWS can reduce the impact of COVID-19 on the sustainability of the company?
Okay. I have to admit, we were also facing problem during the first few weeks during COVID. We have lower patient numbers, very low. In fact, our occupancy rate was also just about 1/3 of what we used to have. But we managed to recover within 2.5 months to achieve a comfortable position. And what we did was, of course, we have to minimize all the overtimes. In fact, we have to eliminate overtime payment to the staff and some allowances during that period. And what we did was divide our staff to reduce the risk of infection. We divide into few groups according to the services. So these are the things, but we didn't touch in terms of, fortunately, we managed to sustain, and KPJ as a whole didn't touch the financial aspect, their salaries. In fact, as I mentioned before, we managed to give even bonus during this difficult time, up to 3 months, Mr. Sugu. So we didn't really.
It's a good bonus.
Yeah. Yeah.
On another note, you have a slide that you presented on what you call a burnout.
Burnout, yeah.
Page 10. Give time to renew for fuel. What is that means?
Sorry. Okay. Staff burnout. For example, here in the hospital, majority are nurses. Yeah. There were times when occupancy rate is high. There are staff that they have to do overtime, often due to high occupancy rate. Because it is difficult, because now we have okay, during this difficult time, some of the nurses we send them for training. Okay, so that's why we have shortage of staff at certain period, and there's few staff who are willing to cover for the clinics, for example. So I have to strategize to reduce their burnout. Although there is no real burnout, but I've told the chief nursing officer we have to eliminate excessive so-called any extra overtime that the staff do, so that they have balanced work and life at home.
Yeah. Wonderful, wonderful.
It's only in nursing. The rest of the services are quite okay. Yeah.
Good. On the innovation part, which you have collaborated together with Unimap, that is different ways. How does that synergize PLWS?
Okay, one is, of course, it'll encourage our staff to innovate more. They are proud that their innovation taken seriously, into consideration by the management, and they are proud they are part of, us. Yeah, for example, for example, the flexi support, we will get the reward, accordingly, because we are going to patent it. Yeah, we are going to patent it, and we're going to commercialize it. Yeah. So these are the things. Yeah, and so here in KPJ Penang, we have a lot of I would say suggestions and ideas. Some of them I told them directly. Certain things cannot be implemented. For example, this year we have to postpone it, but they are okay. So these are the things that keep them moving, and with the link of incentive that we are giving, I think it will encourage more innovation and ideas in this hospital.
Wonderful.
Okay, Zabidi, there's just another question.
Yeah.
You want to implement the PLWS system. There are three main elements. That's one talking about the transparency of the company, the mutual trust among the employer and employees, and the mindset, or we call it behavior inside of the companies. I think one of the main importance that we have is management commitment. Okay, in your opinion, among those factors, which is the most important element factors that will ensure that there will be a success in implementing PLWS system? Because why? The implementation varies according to the sector. With the current situation, I think the most affected, like tourism industry, manufacturing, are facing a lot of difficulty. Okay, So one of the most important elements that required by any companies in any sector to ensure that they will implement PW system to make sure that they can survive in the current work environment.
One thing very clear in our group is the leadership. I mean, it's at all levels, commitment from leadership. And I'm very fortunate because we are getting very good support from our HQ. No, unlike maybe unlike other private hospital group, we are getting very good support from HQ. Because okay, some other private hospital may have some certain degree of autonomy in decision-making process, yeah. But here we are, in terms of control by HQ, it is quite significant, yeah. So it's leadership from HQ, the support from HQ, our board, and also the head of services. The head of services. So I would think that leadership is critical in this. You know, without leadership support from the hospital level and also HQ, it wouldn't be possible to achieve what we achieved thus far.
Yeah, I think I totally agree with you that leadership play a vital role in implementing the system. You can have a lot of system in the marketplace, but if there is no commitment from the top level, the system does not work. I think one of the main criteria leadership must be there, and they must be expected from top to down. So the commitment should come from the higher level, then you down to the lower level. Then once you committed, you will ensure that the system can be succeeded, to be put in place for any other company. Okay, because currently doing business not to make money or whatsoever is talking about the survival of the company.
Yeah.
And the survival only happens if we can have a good employees. Okay, human capital is very, very important role. Of course, when you're talking about human capital, you're talking about compensation. If you can give a very good compensation and reward them accordingly, and also you value them at a high level, okay, not talking about how you see the productive whatever, but what is it for them when there is improvement in performance. And I totally glad to hear that at this current situation, you managed to give bonus 3 months. Again, not many companies talk about that, because they think we need to keep some money for the future investment.
Yeah.
But at these difficult times, you still contribute to the employees to make sure that they can overcome their difficulties currently through bonus payments on. Okay, thank you.
Okay.
In KPJ, if I may add, it's not just monetary, it's the whole culture actually, that continue to promote all this positive value in our organization.
Good. Just to have your associate Puan Zura, probably you can share something on the talent group of staff that you have in KPJ.
Okay, thank you, Mr. Vincent. So, can you hear me?
Yes.
Okay, so I would like to add what Zabidi has informed us. Is regarding implementing the PLWS. Okay, most of the employers, when we want to implement the PLWS, we think about retaining our staff. But other than retaining the staff, it's important to value the staff first, so that our objective to retain the staff will be a success. For us of not valuing them, I don't think PLWS implementation will be successful in the organization. It should come with a value of staff first.
Commitment.
This is what's happening in KPJ and KPJ Penang as well. When talking about bonus, not to tell people that we are having money on that. Yes, we are suffering during COVID time, But when we think of valuing people, then that becomes our important part to give it to the staff so that they feel appreciated. And at the end of the day, we will get a satisfied employee. A satisfied employee may contribute to the success of the organization. That's
that's wonderful. You're part of the team too. This success story that you all have. Wonderful. So I don't think so. We have any other questions in our lineup. Mr. Subu, so should we wait for any questions, or do we need to ask any questions at this point of time?
I think, Mr. Vincent, I think we had a very good session today.
Yeah.
We have a company that really practice PW system,
Yes.
and it's given indications that the certain survival of the company, how they transform their business environment. And also, as Zabidi and Azura also, keeping a very good staff is very, very important. Not monetary alone. Non-monetary also very important. Even if you give them a very, just recognize them by sending a letter, thanking notes, congratulating, whatsoever, even voucher, they appreciate it very much. Because for some employees, small token appreciation bring back a very motivated environment to them. Okay, so I think for the 1.5 hours session, we had a very good sharing of the practices of PW system. So on behalf of MPC, I would like to thank both our distinguished guests today, Mr. Vincent as the moderator, and also we have our CEO from the KPG Hospital, Encik Zabidi, and also Puan Azura, for sharing a very wonderful, interesting practices of PW system. With that, ladies and gentlemen, I would like to end the session today. And thank you once again to our distinguished guests, who have shared the most interesting practices. I hope all the participants can take back a very good indicator experience from KPG. And what's mentioned by Zabidi say that the success and failure of the system depend on the leadership. Correct. If the leaders are committed to implement the system, indirectly talking about, you can overcome whatever system or difficulties you have in the company. And of course, we must value the employee is one of them. Because the survival of the company not depend on the employee alone. We're also talking about the employees itself. If there is no employee, there is no company, no business. So the survival of the board of the company depend on the employees. And of course, PRWS is one of the tools that can make sure that the existence of PRWS system will continue to enhance or make the company survive in the difficult times. And on the COVID-19, I think this is the right time for the company to rethink how they should restructure their corporate system towards recognizing and motivation the employees. With that, ladies and gentlemen, I would like to end the session today. Thank you very much for participating in this webinar. This is the first series. We will follow up another few series. We will call a few other distinguished guests to share their best practices to us. Thank you again to our distinguished guest, Mr. Vincent as a moderator, Encik Zabidi, CEO of KPJ Hospital, and Puan Azura, who are supporting us in organizing this webinar. Thank you, ladies and gentlemen. Lah.